I'm Becky Malby. I run the Centre for Innovation and Health Management at the University of Leeds. And I'm going to tell you a story about co-producing Leeds. So a few years ago, we identified a group of us sitting down and talking about the major health issues in the city. One of those was folks who were having trouble with drug and alcohol. But it didn't feel like anybody in the city was that bothered. We certainly seem to have a lot of homeless people in the streets of the city. And we decided that we would try a completely different approach by working with service users and their carers to co-design and co-deliver and co-create completely different services for them in the city. And so we ran an event. We had 200 people, 120 of which were service users, and 80 were service providers and commissioners. Now, that sounds easy. It really wasn't easy. It wasn't easy to get the professionals there. Really easy to get the service users there. So everyone always thinks these are hard to reach people and they won't want to. Where do you find them? Where do you go find drug users? Well, I think that's pretty simple, really. You sort of bump into them on the street. So we did absolutely that. We just went out into the streets and asked people and said, look, we're having this day. There'll be food. Are you interested? Are you concerned about? Are you interested in health services for folk who've got drug and alcohol dependencies? And we ran a little taster session for those that wanted to come, so they had some idea of what they were coming into, because it was pretty foreign territory. Getting health professionals there was less easy, partly because they're saying we're already doing a great job, why do we need to do this? And so we ran this at the town hall, and the town hall, because this is a building that belongs to the people of Leeds, and we wanted to be on neutral territory. And we managed to get folk in, and there was a level of frisson in the room as people realised there really were 120 service users and carers in the room. Anyway, out of that came a number of ideas that were generated by service users and health professionals together. Some of them were great, some of them were clearly nuts, but worth a go. And we then said, so anybody that wants to have a go at those, these are ideas coming from the floor, people forming little action groups. So go away, do your best, what can you do together? But we'll host a few lunches and then we can share ideas and learning. And at the next event, which was a few weeks later, 70 people turned up. And we had lunch and we thought actually sitting down and having lunch together is just good human relationship stuff. And that if we eat together, we start to talk differently and we start to see each other as equals. This is just what humans do, certainly in our country. Sit and just have a meal together, and then you have to talk about other stuff. You can't talk about services and my addiction. You can just talk about my kids and my family and my mum and what I did at the weekend. And we found that those were really great levelling conversations. And as we started to test out and try out some new things in the city, we realised that other people might have done it better somewhere else. And so some folks went off on learning journeys, and we had, a GP sitting next to a homeless person, sitting next to a drug and alcohol worker, sitting next to a commissioner on the train to London to visit Bromley by Bow, as a delegate group from our community, having to travel back together. These folks have never inhabited the same train journey ever before. And it absolutely changed the relationships between the service providers, the commissioners and the service users in the room, with a few lurkers who were not wildly enthusiastic for all sorts of issues around power. And when we went back halfway through this process to say, so what's different? What we found was that for everybody in the room, something was different. Either service users themselves had generated confidence and were doing things like volunteering to be peer mentors, or service providers were changing their service, or they fostered new collaborations. The prison service was working with one of the drug services, they were doing joint cooking courses or something. All sorts of small things were starting to change. And people were starting to blog and write up what they'd learnt about each other. And one of our very stoical, very intelligent folks who had trouble with drugs stood up at one point and said, I am fed up with everybody being so defensive. Can we all just assume we're all here for the right reason? We understand you have a difficult life as a service provider. We absolutely understand that. We're not expecting you to be God. We're expecting you to be humans. Just help us out. We're an absolute nightmare to work with. We hardly ever, we don't turn up, etc. So that it was really neat. And looking in from the outside, a couple of years later on our bigger evaluation, we've radically changed the commission. The whole of health drug services in Leeds are commissioned completely differently now. So commissioning is radically different. It's based on a locality model. What the service users are saying is we're not all the same. Some of us have got families, some haven't. Some want to kill ourselves. Some of us can cope with a level of drug use, and just need some sort of help with that. Some of us really, really want to abstain, but don't provide one service for all of that. And don't provide the same service in every place, because our community is different. The assets in our community is different. What we're prepared to do for ourselves is different. So the sort of student population in the old Alkies in the north of the city is very different from the east of the city, where there's much more drug prevalence. So don't think it's all the same, and go into communities and find out what people are prepared to do for themselves. And so that was one of the biggest changes. And then there started to be services that the service users were beginning to do for themselves. So co-production is together, produce, make. Anybody can do this work. It might not necessarily be health professionals, but actually sometimes service users can do it for themselves. And one of the comments on the external evaluation was that service users had come and gone, and they said this was a sign of it not being successful. And I think it's really interesting about your ideology, because I see it as a sign of it being really successful, that the co-production process can carry on with a momentum, no matter who comes and goes, because certainly, why would service users want to stick at a process for 2 years? Why would they? And so there are lovely, delightful stories of people in recovery. There's a gang of service users setting up a dry bar in the city. We've got a social movement going on that's partnering our liver surgeons with our docs, with our service users, with the students' union on minimum pricing in the city. And it just seems to keep going. So 3 years on, there's still new projects coming out of what started off as a conversation based on everybody's an asset. Start with listening and give everybody an equal voice, and maybe we can do something better together.